Hi, my name is Pumpunintanam. I am going to set up an IVPB bag and changing gown for validation. So first, we begin with the 7 step. So I check physician order. I interview myself. I identify patients. I set up my equipment. I wash my hand. I explain the procedure, and I provide privacy. Okay. So after I wash my hand, I'm going to check the patient. So I check for IV site, make sure it's no redness, swollen. So everything looks okay. Now my equipment, I have IV solution and tubing. So for IV solution, I make sure it's not expired, it's the right solution, and the tubing. So I label the tubing, I label solution. So I open it. Before I attach it, I make sure the tube is clamped. Spike into the IV bag. And I calculated drift factor from the physician order. It's going to be 60 drops per minute, so it's going to be 15 drops per 15 seconds. I'm going to hang it. I fill the chamber halfway, and I am going to prime the tube. Okay. I open it. So make sure there's no air. Oh, I have to unclamp it first. Okay. And I will do 15 drops per 15 seconds. Okay, I start to count 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. So I clamp it. And I close the tubing before I give to the patient. Okay, so before I give an IV for the patient, I make sure I clean the site first, the heparin lock. Clean. I open it and I connect the IV to a heparin lock. So because this is validation, I'm not gonna put it in the reel because it's gonna wet the bed. So after I connect it, I just unclamp it, and the patient will get the IV 60 drops per 1 minute. So before I leave, I make sure the patient is comfortable, bed rail up, and in the lower position, and I document it. So now after that, I found out that the physicians want to add medicine to the patient for the IV piggy bag. So I'm gonna begin with 7 steps. First, I have to make sure it's the right patient, right dose, right drug, right time, right route, right reason, and I document. So I check the medicine with patient mark and patient order, compare, and I check the label 3 times, compare 3 times, and then I timestamp my name and medication and date and time. So after I put the label, I prepare my tubing. So and this is sterile, so I open it and I clamp it in. Okay, I make sure that the tube is cramped so the medicines not come out. I am going to hang it. I fill the chamber halfway and I prime the tube, so make sure there's no air. Okay. Oh, okay. Okay, I already primed the tube, and I am going to attach to the primary IV solution. So and then I'm going to wipe it with alcohol, and I wipe it. Okay. And I am going to attach it to primary solution. Okay. So after I connect it to primary solution, I turn it on. I'm sorry, I open it all the way up, and I recalibrate the refractor again. Okay. Now I am already add the medicine to the primary IV. So the physician order is 30 minutes. So I will make sure that patient is comfortable, and I lower the bed down, and the call bell is in reach. So, okay. After that 30 minutes, I'll come back to remove medication. So I stop the medication and remove it. And I will recalibrate the drip factor for primary IV. Go back to 60 minutes. 60 drop per 1 minute as the beginning. So since the patient is need to be changed, so I'm gonna change the gown for the patient. So I'll check the patient, the IV site, everything is okay, no redness, no swollen. I'm fine. So I lower the bed. I raise the bed up to the working height. And I am going to change the gown. Oh, I'm sorry. When I do the IVPB bag, I need to lower the primary bag down so that the IVPB bag can start to go to the patient. I just fix that. So come back to I'm going to change the gown to the patient.
It's done taking it from here, and now it's trying to put it onto the website. But okay, I have 0 too.
But make sure I wash my hands before I touch the patient.
Have you too?
The room is maintain privacy because I am going to change the gown so that the patient is not exposed to people who around here.
I was, but then I was shaking with that thing. I like this one. So of course you were shaking. I was shaking. And then I would have liked to have done sterile, but I don't know. It's like this? Yeah, yeah. You have to sign it. You don't have to do it. So what do you do? I know. And then go down to the bottom.
One arm first, and then the second arm.
I just wanted to sign out. Go ahead, create your account. You're crazy. You're like rushing me. Yeah, something. I need a current.
Okay. And I put on a soy linen.
Nice. Good. What are we doing? I would like to do sterile field, but we only have an hour left of lab, and I don't think all 4 of us will be able to do that. So, we want to take this hour.
Okay. After I change gown, make sure the patient is comfortable. Raise the bed rail up, lower the bed down, core belt in reach, and I am documented. And I wash my hands, and I finish.